All right, today we're going to look into contact tracing. It's this next step in this COVID-19 phase of tyranny. So let's get into it.
With, as we heard earlier, the number of cases expected to climb in coming weeks, many experts say the next phase in the response to the COVID-19 pandemic will require aggressive contact
You hear
tracing.
that?
Amna
Aggressive.
Nawaz reports on how tracing works, why it could help, and the concerns over privacy.
Krista Cass's path to medicine was not the norm. A West Point grad, she served 3 tours of duty for the U.S. Army, then went on to become a physician's assistant in Boston. In March, like many places during the
Why is
pandemic,
this a
all
picture that you
elective
would show? Look at this.
Point grad, she served 3
Hammer into
tours of
somebody's
duty for the
body with
U.S.
blood all
Army,
over
then
you?
went on to become a physician's assistant in
Is
Boston.
this a training
In March, like
exercise?
many places during the pandemic, all elective surgeries here were paused.
We can't operate and replace hips and knees right now. I just kept thinking, what can I do? How can I help? How can I be involved in this public health crisis?
Massachusetts has about 70,000 confirmed cases of COVID-19. And last month, Governor Charlie Baker gave Krista her answer, announcing a new phase in the state's fight against the virus: aggressive contact tracing.
See how they keep
I was
using
one of
that
the
word?
first applicants.
Aggressive?
I could not wait to get my hands on this.
Krista was hired by Partners in Health, a Boston-based global health nonprofit working with the state to hire, train, and deploy 1,000 new contact tracers at a cost of $44 million.
Okay. So there's already a major amount of people in debt not getting their unemployment wages or income, and they want to dedicate whatever millions of dollars to pay people to trace people who have come into contact with people who have coronavirus. Let's continue.
The process is straightforward but time-intensive. First, contact all new confirmed cases of COVID-19. Find out everyone they came into contact with while sick. Then reach out to those people to tell them that they may have been exposed and will need to quarantine.
Bam. Invasion of privacy. First, transgression of someone's rights. Second, telling them how to move with their body. Second, transgression of humans' right. They said they're going to identify those who test positive for coronavirus, track down everyone who they've come in contact with. Blatant disrespect of someone's right to privacy. And then they're going to try to get in contact with those people that they've tracked down and tell them they should be quarantining. Wow.
First lines you deliver to people.
I would say, hi, I'm Krista. I'm calling from the Community Tracing Collaborative at the Department of Health. I'm calling to let you know that you've been exposed in the past week to someone who was diagnosed recently with COVID-19. And then I take a break because that's a lot to handle and a lot to hear.
The work,
It's
she says,
bullshit.
is about
You
more than
shouldn't be
just
calling them.
informing people they might have been exposed. Contact tracers explain how to quarantine the right way, how people can protect their families.
You don't need to be
get
contacted.
groceries and medicine.
Look, if you're feeling sick, then yes. Most people are going to be staying in their home. When you get sick, you stay in your home typically. All right? If you're not sick, you don't need to be stuck up in your home waiting to be feeling sick. That's the whole thing. Your immunity is not built by staying in your home. If you're not sick, you have the freedom to move around, even if you are. But it's not smart if you are sick, just stay at home. If you're not sick, move around freely. You shouldn't have someone calling you, telling you that you've been in contact with someone with coronavirus and them suggesting you need to stay at home.
Pay their bills, even find help for domestic abuse.
We are not just collecting data. We're doing more than that.
We're not just collecting
extensions
data.
of our client, of our contact social support system, and we're connecting them with the resources they need.
No.
Used around the globe in response to diseases like
global
cholera,
effort.
HIV, and Ebola, contact tracing has long been a critical public health tool to map and control outbreaks.
This is how
people are
you
not
stop
in your
running away
best
from the
interest.
virus and start chasing it down.
Don't trust the medical
Now,
system.
with the Center for Global Development, Jeremy Konyndyk helped manage the Obama administration's Ebola response in West Africa, relying heavily on contact tracing. Ramping up a national program here, he says, could not only help stop the spread, It could also help avoid large-scale shutdowns.
It could help stop
Because
the
of
spread.
inadequate testing and because we don't have
Wow.
a national contact tracing infrastructure in place in the United States, we in effect have to presumptively quarantine the whole population. But with contact tracing at scale and testing at scale, then you have the ability to quarantine only those people who have actually been exposed to the virus.
Digital
You don't have a
tools
right
to
to
track
quarantine
people's
anybody.
movements, he says, like those used in Singapore, Israel, South Korea, and many other countries, could also help. But tackling the scale of infection here in the U.S., on top of years of slashing state health budgets, means more federal leadership is needed.
The estimates now from Johns Hopkins are that we may need somewhere around 100,000
John
contact
Hopkins.
tracers across.
Let's stop there for a second. John Hopkins was one of the major creators, or not investors, but like they were involved with the setup of Event 201, along with the World Economic Forum and the Bill and Melinda Gates Foundation. Event 201 was the precursor to the coronavirus. Back in October 2019, they were already planning simulations for what was to come.
The United States. And I think that that's the sort of order of magnitude we need to be thinking on here. That's a lot of people, but also that's an achievable thing.
Some estimate the U.S. will need nearly double that number of contact tracers, but so far states are largely rolling out their own individual plans. North and South Dakota are two of a handful of states which have not issued stay-at-home orders during COVID-19. Together, they've so far seen around 3,500 confirmed cases with fewer than 50 deaths. Officials now hope a new location-based app can aid their efforts to keep the virus at bay.
It turns out that most people, including myself, can't remember on a good day where I was 5 days ago, let alone if you're sick.
But you want to give all that
Tim
data to
Brookins
someone
is an app
else
developer
so
in
that they
Fargo,
know where
North
you
Dakota.
were.
In 2014, he developed Bison Tracker, an app that let North Dakota State football fans track each other as they travel together to away games. In April, he repurposed that app into this one, the Care19 app, which tracks and compiles users' locations, so if they do test positive, they can easily share.
He already had the data of people who was using this to, track each other because they were fans of the same team. Took those same data points, those people who were signed up for that service, and now is able to roll that out as an app to track people because of a coronavirus. You see how that works?
That data with a contact
Don't trust
tracer.
a tracking
Brookins
app,
says
man.
it will protect
They will use
users'
it against
identities
you.
while making the process more
What does that
efficient
mean?
and accurate.
Protect someone's
But he acknowledges
identity.
these efforts require
You're
buy-in.
tracking them.
It's hard. People need to really take time to digest, what is the new
Don't
normal
use Care19
after this, and come to terms with the idea of location tracking.
Wow, you said
Google
come to
and
terms
Apple
with
recently
this.
announced they're
Just
working
give
on
up your rights and come
contact
to
tracing
terms is what
technology
he wants
too
you
to
to do.
roll out in mid-May. But the rushed tech response has some privacy experts worried.
We're essentially building the airplane while it's flying.
John Callis is a former security expert at Apple, now with the American Civil Liberties Union. They recently published a report outlining principles to protect privacy and civil rights in contact tracing technologies. Among those principles, that the technology used should be voluntary. Tracking information should be stored on a user's phone rather than a government or company server. The data should be routinely cleared out, and these programs should end when the pandemic does.
It doesn't matter if it's on a government
necessary
server or if it's on your phone, because those same government people are going to be able to access the data no matter where it's at. The telecommunication companies work in direct correlation with the government.
Only to protect the public from increased surveillance, as seen in China, but for public health efforts
seen
to
in the
fight
U.S.
the pandemic
In Baltimore,
to be
they're
effective.
surveilling the
We
hell
have
out
to
of the
get the
people.
trust of the people who are using this. If people don't trust that this is a system that will benefit
They shouldn't
them
trust it.
and their community, they won't use it. They'll balk. They'll push back. I mean, we already see people in the United States who are pushing back on things.
Ultimately, though, experts agree that digital
They
tools
want
should
no
complement
pushback.
human contact tracers, not replace them.
While the app may be efficient, it's not familiar, nor does it have a human voice on the other end of it saying, by the way, I know I'm telling you that you've been exposed, and the second thing I want you to know is I am here for you through this process.
No.
A process to slow the spread.
All right, so we're going to take a look at this other video of what they're talking about with contact tracing.
Inside this government building, in this room, is a new front in the fight against coronavirus.
So the only symptoms that we have on board right now is just the mild body pain. Is that correct?
At a call
Why are they
center in
calling
Fairfax
people and
County,
asking
Virginia,
them what
outside
symptoms they're having?
Washington, employees with the
Compiling your
public health
data.
department are doing contact tracing for the virus.
When we do reach people, it is important for them to understand why we're calling. There is a sense of unease about the COVID-19 pandemic, and to have somebody from the government calling is often perceived as intrusive.
It is intrusive. That's why it's perceived that way.
Doing this sort of detective work will be key to getting the country moving again.
Testing widely, isolating those who are infected, contact tracing, and quarantining the contacts. That's a box. Get those 4 things right.
Let's hear that again.
A sense of intrusive.
And at any moment, were you admitted into the hospital?
Doing this sort of detective work will be key to getting the country moving again.
Testing widely, isolating those who are infected, contact tracing, and quarantining the contacts. That's a box. Get those 4 things right. You can keep a virus in the box so we can come out more readily.
That's
contact
tyranny.
tracing or infection control works like this. It requires large-scale testing to identify who has the virus.
First, allow them to
Once
intrude
someone
your
does,
body,
they're interviewed,
stick
asked
whatever
to
they want up
remember
there,
who they've
and tell
interacted
you
with,
that you
at a range
have
of
something.
closer than 6 feet for 15, maybe up to
Then
30 minutes
isolating
over the
you
last
from other
2 to 3
people.
days. The contact tracer then calls all of those people,
Then telling everyone you've been around
virus,
that you've been
recommending they
exposed.
isolate
Wow,
themselves,
man.
limiting
This is
contact with other
direct
people for
violation
the
of your
next 14
rights
days.
to
The
privacy of your
contact
health.
tracer may then follow up to see how people are feeling and to remind them
And
to
then I'm
stay
going to
inside.
track you down and continue to call you and harass you about your own health.
All of this
Don't
is
answer their
nothing
calls,
new for those
please.
in public
If
health.
someone says they're
We do it
calling
all
you
the
about,
time. We do it for sexually transmitted infections. We do it
contact
for
tracing,
tuberculosis.
hang up on them.
And some
Don't
people
give them
remember
data.
last year when we had the big measles outbreaks in New York State and the Pacific Northwest.
Yeah, now we're not hearing nothing about that, are we?
And infection control to get all of that under control.
Marcus Plesha is Chief Medical Officer with the Association of State and Territorial Health Officials, which represents every state's public health department.
Our approach is that by strengthening those interventions, we can keep the spread of the virus damped down.
The challenge now is finding help.
We don't have the numbers. I mean, there's so many more people getting infected with this than any of the other infections that we routinely handle.
And if there's so many more people getting affected, that's bringing your death rate down. This is not a highly deadly disease. Okay, so you don't need to track all these people. There's more people dying from cancer, from car accidents, from heart disease. And you're worried about a low death rate of people succumbing to a virus?
There are only a couple thousand people in the U.S. who normally do contact tracing.
We're going to need tens or hundreds of thousands of people doing this.
Wow.
It sounds overwhelming, but we've got to do it.
When Tom Frieden was director of the Centers for Disease Control, he oversaw the response to the Ebola epidemic in 2014.
We all want to get out. We all need to resume our economy, our healthcare system, our businesses. That's essential for our lives. But being safe while doing it is going to require going about it in a different way. And part of that is scaling up our ability to contact trace and box the virus in.
The state of Massachusetts has brought on Partners in Health to hire and train people in contact tracing. The nonprofit has mostly worked in the developing world, battling Ebola and HIV. In New York,
well, we have to put together a tracing army. Yes.
They just want to track you people.
Okay, we put together armies before, never a tracing army.
Doing all of this well means
a really good contact tracer is going to have
turn your location settings off.
Good communication skills, able to get on
turn your
phone
Bluetooth
with somebody
off.
and win their trust pretty quickly.
Shut your device down when you're not using it.
Speak in a way that is credible for the folks that they're
if you don't need a smart
Plesha
device,
says
get
there
rid
used
of
to
it.
be more contact tracers out in the field, but over the years, public health budgets have been cut by a third. The CDC also does this kind of work. Albany, Georgia had one of the earliest and deadliest coronavirus outbreaks, stretching the only hospital there.
I was sort of perplexed because when I found out these individuals from the CDC were coming down, I thought their primary objective was to assist us in curbing the spread of the virus. But actually, They are here as infectious disease specialists. It's what they call contact tracing. And what they are trying to do is establish this pattern so that the virus can be combated more effectively elsewhere.
But combating it will take testing and contact tracing and more testing, which is still an issue in many parts of the country.
Dr. Fauci, that we're just not there yet.
No, I don't agree with him on that. No, I think we're doing a great job in testing. I don't agree. If he said that, I don't agree with him.
The plain fact is we don't have enough tests in the US today. So we're going to have to test strategically, especially people who might spread it widely or for whom testing will help to save their life.
In other countries, cell phone apps are tracking who has the virus,
tracking everyone
warning
all
people
around
when
the
they
world.
encounter someone who's infected. This sort of surveillance could happen in the U.S.,
Exactly
but it would be voluntary, given worries about privacy. So contact tracing here will largely be done the old-fashioned way.
Okay.
I would ask if you have been ill or if someone in your family has been ill or been tested, that if you get a call, that even if you are reluctant to pick up the phone, that you listen to the voicemail.
Do not
and the
hang
public
up on
needs
them.
to be prepared for this.
We need people to know that this is coming. We need them to know that although we're opening back up, there are going to be some cases where people are going to be contacted and asked to go back and stay in their homes again for a couple of weeks.
You're going to be contacted
and
told to get out of my life.
Everybody needs to realize
don't infringe upon my rights.
That's the right thing to do to get us through this. Everybody's got to do their part.
Okay. All right. Thank you so much. Bye-bye.
All right, so there you go. Now you can see what they're calling contact tracing. Okay, I just want to go over a couple things. One is your body. You do what you choose, what you feel is right for your body. If you feel like contact tracing is the right decision for you, then there you go. But for all of those who care about our rights, our personal privacy, then we need to make sure we pay attention here and not engage these people when they're trying to track us. Okay? Get rid of as much potential as they have to track you. And if this is happening in your city, contact the people who are responsible for this and tell them why this is wrong. All right, that's what I hope to inspire you guys to do today. I just wanted to go over contact tracing and how this coronavirus, COVID-19, so-called virus, is continuing to be used to usurp our rights. All right, so we'll continue as more comes along. You guys take it easy.